presentation. So I am going to go ahead and share my screen in just a minute. I remember the old days where I just worried about tripping on the way up to the stage or if my little clicker didn't work. Now I feel like I'm an air traffic controller with all these screens. So let me set up. Okay. And share screen, and we're going to go over here and here. Hold on just a minute here. Y'all see health insurance for Hoosiers pretty big? Is it the full screen?
Yes.
Perfect. Yay. Okay, so there we are. Health insurance for Hoosiers tonight. And I can't see you anymore. So Tiffany, if you can't hear me or we have an audio or video issue, just yell at me.
Okay, sounds good.
You won't be the first. All right. So I didn't make a mistake. I'm still not fumbling. It should be blank on your screen, right?
Yes.
Okay. Well, I left this blank intentionally because I want to do a little word association exercise. I'm going to say a word, 2 words actually, and you don't have to say this out loud, but I want you to think about what the first thing that pops into your mind is. So the 2 words I'm going to say are progressive insurance. So just think about that for a minute. No right or wrong. So maybe something like auto insurance comes to mind or home insurance. So now clear your mind again. And when I say flow from progressive, what pops into your mind now? Maybe this. So I think it's a safe assumption that most of you probably recognize flow from progressive. But why does flow work so well as the face we associate with progressive insurance or insurance in general? And why am I talking about flow? So Virginia Commonwealth University Brand Center Professor Kaylee Caldwell, and I'm just being very professional and quoting my sources, says, flow humanizes insurance, something that can feel pretty impersonal. She goes on to say, we are paying for something we hope we never need. And if we do need it, we want to believe that it will be easy and human. Flow seems like the kind of person we would hope to get on the other end of the line to help us through an unpleasant situation. That seems simple enough. She goes on to say, flow, again, humanizes insurance, something that can feel pretty impersonal. So this is exactly my hope for this evening. We're going to look at health insurance in Indiana and the options of obtaining those health insurance. And we're going to kind of focus in on a couple in particular. So again, the learning objectives, explain the different health insurance options in Indiana, explain and compare costs and eligibility requirements for different health insurance, and explain the role of an insurance navigator. And I was super excited when somebody said they were excited to learn all about this. So that's a good start. So I'm going to start with a few introductions, and I'm going to attempt to connect the dots to help explain exactly what my role is, who I work for, my project efforts, and how it relates to you and Dress for Success. So my name is Ann McCafferty, and one of the professional licenses I hold is that of a Department of Insurance Certified Navigator. And when we're finished, you're going to know exactly what an insurance navigator is and what they do. So we're going to circle back around to that. I am a project coordinator at Indiana Rural Health Association, or IRHA. I'm going to refer to it as IRHA going forward. And the project team I belong to is called Connecting Kids to Coverage Indiana. And I know that's a lot. And I hate that all my titles, all the roles that I fit into kind of, they kind of sound like they exclude people. So Indiana Rural Health Association, we're not just rural effort, and Connecting Kids to Coverage, it's not just kid focused. There's my dogs. So when I say connecting kids, we're adults as well, and Indiana Rural, we're urban as well. Sometimes I wish I could just say I'm a preschool teacher at Little Daisy Daycare or something. That would be much easier. So a little bit about IRHA. IRHA was founded in 1997, and you can kind of go through this list and read the list, but I'm going to summarize it and kind of give you the big picture. So we're a member-driven, not-for-profit organization. Those members consist of a diverse group. They may be representatives from hospitals, rural hospitals, community health clinics, community organizations or ministries, and some are just individuals with an interest in community health. Together, these members form a consortium that conducts needs assessments, and then they bring this information back to a round table, so to speak. And they focus on those community strengths and weaknesses, and these are discussed. IRHA then, and not always alone, sometimes we partner with other organizations, look for programs and funding to help provide solution for these identified needs. I think we could all safely agree that health insurance is a community need throughout the state, and certainly a barrier to accessing quality healthcare as the result of either no health insurance or being underinsured. And underinsured means that the health insurance that you do have still leaves you with cost sharing, for your portion of the cost, that you find unaffordable, like a deductible. I've certainly experienced that in my own personal experience. So in an effort to reduce the percentage of uninsured and uninsured Hoosiers, especially children, IRHA applied for a funding opportunity with the Centers of Medicaid and Medicare Services. And this was a national campaign, and the funding was awarded to 39 grantees nationwide. And IRHA received this award, and it was the first time they had received it. And it's a 3-year cooperative agreement, and we are just entering into our 3rd year. And I have to brag on our team a little bit for a minute. Our team only has 5 people. We're actually down to about 3.5 now, and the half is we have 1 part-timer. And you can see that these were the goals we were tasked with. And those program goals were to raise awareness, create opportunities, motivate parents. Well, we couldn't connect to people on that grassroots level anymore the way we intended because of the pandemic. And obviously we could not go into these communities to reach out to the people that needed our assistance. So I would say that our team just worked tirelessly and came up with great new strategies. And we've actually gained national recognition for these efforts. So we're really looking forward to applying for that 2nd term for the CMS grant. And this I have to include in every slideshow I do. So this is a disclaimer funding opportunity that gives a little bit more detail. So if you're really bored one night, feel free to look that up. We'll read a little bit more about us. So with that out of the way, let's just go ahead and dive in. And we're going to talk about health insurance options in Indiana from a high level view. We're going to do this as kind of a 101 class. So what are the basics of health insurance? The basics are, it won't always cover all of your costs. It's much like your auto insurance. Most of us are familiar with that. We pay a monthly premium, And then in the event that we incur damage or total our vehicle, through that monthly payment, we know we have an agreement that we're not going to have to take the burden of all those costs upon ourselves. It's exactly the basics of health insurance. We pay, the health insurance company says, we're going to help you pay this much in the event that this happens. So it's designed to share costs with you. However, the good news is there is a limit to the amount of costs that you're required to share. So my friend that got excited about open enrollment in October and what to look at in their health insurance options, you want to pay attention to this out of pocket maximum that you're guaranteed. So when you've shared the cost, you're going to stop. And you know what? That's the peace of mind that insurance does bring you. So those are the three very, very basics. So I've listed some ways that you in Indiana might obtain health insurance. And I'm not going to go through the entire list, but you'll notice that some on this list have yellow arrows pointing to them. The first one's employer health insurance plans, marketplace plans. I've highlighted Medicaid, CHIP, which is the Children's Health Insurance Program. And then the others, you're probably, if you don't know how they operate or who they operate for, you're probably at least familiar with them. But the highlighted ones are the ones we're going to focus on. And then you'll also notice I've put a big green check mark. So why do I have a big green check mark on these plans? And some have an asterisk. So like everything, there's a little bit of a caveat on some of these, but I'm going to teach you why I've included the big green check. And that is because these plans are considered to be quality health plans. I'm going to call them QHPs going forward. There's a lot of acronyms in my business. So QHP, Quality Health Plan. And what defines these as a quality health plan? So these quality health plans meet the requirements of the Affordable Care Act. And I think we're all kind of heard that term, at least the ACA, Affordable Care Act. And this happened, this was a law that was passed in 2012, don't quote me on that, sometime around there in the Obama administration. And it was the biggest overall change to health insurance in the country. And part of the Affordable Care Act said that a QHP must offer a minimum actuarial coverage cost, and don't get too hung up on that, those are some big words, of 60%. So what that means is of the cost that you're going to have to share with your insurance company, they're going to guarantee that they cover 60% of that cost. Now, of course, your plan may cover more. It may be a 70% or an 80% or even a 90%. But to be considered that QHP, they have to cover that 60%. And also within that change in those laws, the Affordable Care Act set certain standards on the benefit types that it will cover. And we're going to talk about that in a little bit more detail. But back in the day, insurance companies could say, okay, we're going to cover maternity or pediatric services, but we're not going to cover mental health. The ACA made it that there are 10 minimal essential benefits that they have to cover. So again, these green check mark plans, or these yellow ones that we're going to talk about today, are all QHPs. Does that make sense? You guys can chime in. We're a very informal group. Everybody good?
Yes.
Great. Okay. So let's look at plans that we've probably heard of, but they aren't considered QHPs. So now we have the big red X's. So we're going to kind of go through this list real quick, and I'll tell you why they're not QHPs, because I want you to hear plans offered to you and know exactly how to identify them. So the first example is what you would call a standalone plan. A standalone plan only offers cost sharing within a certain specialty. And the most common standalone plans would probably be dental and vision plans. And employers oftentimes offer these standalone plans, and you may be presented with an option to purchase one of these plans through your employer's benefit package. If you are employed by a company with 50 or less employees, these employers are not legally required to offer you a quality health program, and that's part of the ACA as well. So make sure you understand what is being offered in terms of insurance as a benefit to you as an employee. Make sure it's not a standalone plan. The second one is what's called a limited plan. And workers' compensation is a good example of a limited plan. This plan pays a percentage of your costs, but it's limited to work-related incidents or accidents, and therefore may not cover all the essential benefits of a QHP. The third, a supplemental plan. This is a plan that offers a supplement to you to help you pay your portion of cost sharing. Now remember, QHPs have a 60% guarantee that they will share those costs with you. So that leaves you with 40% of the cost. So that, you still may have to pay quite a lot of out of pocket. So with these supplemental plans, they come in and help you pay that 40%. And a great example of this is the duck, Aflac. So you may even have them come to your employer. They're very aggressive, which I admire, but if you hear Aflac, know that you're not being offered a QHP or those full guarantee of those 10 categories we're going to look at in just a minute. So a good example, when my kids were young, they were really active in travel sports, and we experienced our share of emergency room visits. And they offer like accident supplemental insurance, which might have really helped us out because, you have $500 ER visit, it still left us responsible to pay $200. And then the last example is a discount plan on medical services. And these seem to kind of be growing in popularity. And you may have heard this advertised on the radio. A good example is a company called Sidecar Health. Sidecar Health members pay a membership fee, and in return, they may qualify for a discount on certain services. So it's a lot like a Good RX card that we're all becoming more familiar with. And a Good RX is not insurance, we know, but by presenting your Good RX card at the pharmacy, you may receive a percentage off the normal cost of that prescription. Okay. So I marked those with an X, and then I marked the others with a green. And I'm not marking those because one's good and one's bad. I'm not saying that these ones we just reviewed are bad. I just want you to know the difference, and I think you'll kind of remember the green and the X. So I just wanted to kind of separate those from a QHP. So here again, in summary, this is, and this will be very helpful when you're looking at employer benefit offers. Remember this, and you can ask them, is this a QHP? They'll know what that is. Does it cover at least 60% of the charges that I incur? And does it include substantial coverage of those 10 essential benefits? Does it have that minimum essential value? Okay, everybody clear on that?
Yes.
Perfect. All right, so I keep mentioning minimum essential coverage and the 10 categories that it has to cover. So let's take a look at those. So here they're listed. You have laboratory services, and I'm not going to read them all. Whoop, sorry, I'm not going to read them all. I'm just going to give you an opportunity to kind of look through them. So if you go to the doctor because you don't feel well, and that provider orders you to do blood work, and as a result, you find out you are pregnant, and this has caused you a bit of stress, and you would like to speak to a mental health provider for a little additional support, you can rest assured if you have a QHP that your insurance would cover at least 60% of all these services. So let's talk about employer offered insurance a little bit. So I'm going to share my slides back to Tiffany. I'm going to give you guys a copy of these, and I'm not going to spend up, time going through each one of these things on this list, but I do want to include it for you as a reference. Group health insurance or employer offered insurance, employer sponsored insurance is the most common way in Indiana to obtain health insurance. Now, your employer may or may not offer health insurance. And again, remember, I talked about if you have 50 or less employees at your company, they, by law, are not required to provide this. Now, if they have 50 or more, they are. So you may receive a benefits package. And in that benefits package, there may be an offer for health insurance. And unfortunately, health insurance, it is somewhat impersonal. We talked about flow. And it's not something we're really taught in school, what a deductible is, what a premium is, what an out-of-pocket is. So a lot of us don't fully understand that. And before I got into this, I didn't know what a lot of these things were. My husband came home and said it's open enrollment. And I said, okay, pick the best one. And that was that. So it's really not taught. And this is really why I love doing this type of workshop, to take and I offer even more in-depth workshops. If you're interested, let me know, just to kind of understand those fundamentals on a higher in more detail. But again, in an effort to save time, here's just a quick reference guide. Find out who your benefit specialist is. Maybe it's through your HR department, or like in my case, my company is very small and our COO handles all the benefits. So find out who that person is. And then ask if they provide an information summary for health insurance plans offered. And that's going to give you a lot of your detail there. And then again, go through this list. And these are kind of the questions you will need to ask. So when it comes time for open enrollment, print this slide off, keep it with you. So what if you don't have this pathway to health insurance? Like we've learned the majority of Hoosiers are insured through this pathway, then what? This was me personally. I was self-employed. I did medical transcription. I was my own boss, and no one offered me health insurance. So what are my options then? So I'm going to focus, the next plan I'm going to focus on is called the Healthy Indiana Plan. Is anybody familiar with that?
I'm not.
Okay. So the Healthy Indiana Plan is Medicaid's expansion plan. And you may hear that term if you listen, like last year with the debates and everything. It's, insurance is a big political topic. And they'll oftentimes talk about Medicaid expansion plans or states expanding Medicaid. So the Healthy Indiana Plan is Indiana's Medicaid expansion plan. Our state chose to expand Medicaid. Now, what do they mean, expand? Traditional Medicaid is offered to very low income, below a certain poverty level, and then those with defined disabilities like blindness or deafness. but not everyone can afford or has access to health insurance that fall into that category. So Medicaid expanded the offer of a Medicaid program. They raised the income level a little bit more, and they dropped the disability guideline. So Healthy Indiana Plan is available for ages 19 to 64 who are not disabled. And by disabled in this case would be defined as you haven't been deemed by Social Security as being disabled. So if you're pending your disability decision, this is a great option for those. All right. So let's look at Healthy Indiana Plan in a little more detail. So since it's offered to those non-disabled adults based on their household and their income, income levels play a part in this. So to be eligible, you have to be under 132% of the federal poverty level. And don't worry about knowing that. I've been doing this forever and I still refer to my chart. And I will show you that chart here in just a minute. And because you're in that income level, they know those cost share situations are difficult for you. So you would have difficulty paying a monthly premium or the monthly amount due for insurance. You would have difficulty meeting a deductible, or a deductible is the amount you have to pay out of pocket before the health insurance company starts sharing that cost with you. So in return, through Medicaid says we will fund that for you. We will fund those cost share items for you. But in return, based on your income level, we ask that you make a monthly contribution. Now that contribution, depending on your income, is anywhere from $1 a month to $20 a month. And it's never more than the 20 and never less than the $1. Also, with that contribution, if you continue to pay that contribution monthly, you receive dental, vision, and chiropractic coverage. So it's excellent benefits. Covers all those 10 minimum essential benefit categories, and it gives you extra dental, vision, and chiropractic. Also, you would not have copays for prescriptions or doctor visits. The Healthy Indiana Plan is carried by 4 managed care entities. That's just a fancy word for health insurance company, and you'll be familiar with at least one of these. In Indiana, it's Anthem. That's the one you're most familiar with. MHS, CareSource, or MedWise. So what that means is that they manage your claims. That's where doctors submit their claims to and are reimbursed by. So you actually have, like, you would get a card that said Anthem HIP on it, and that's your insurance card. Those 4 insurance companies also have their own extra perks, I call them, that you get when you enroll as a member into their company. So you can earn rewards. And kind of an example of these rewards, I think Anthem offers gift cards if you complete a medical wellness survey. I know at one time, one of them offered Weight Watchers memberships, or reduced costs for participating gyms. So things like that. So it's a great way to really, when you get into that managed care entity, you can take advantage of those little extras. So how do you get Healthy Indiana Plan? How do you apply? And how do you enroll? And again, what is that eligibility criteria as far as income? So a few things you're going to need to know when you apply. You're going to need to know the names, dates of birth of those in your household, Social Security numbers, and then your income information. Now, your income information is both earned and unearned income, and it's always the gross amount. And I remember it this way: it's gross. because it's before your taxes come out. So it's gross when they take out your taxes. So it's that gross amount. So before the taxes come out. Unearned income examples, if you receive Social Security, say you're 64 and you took the early Social Security, that would be an example of unearned income. Child support, unemployment. Now, unemployment, the stimulus pay in this situation, that extra that you might have got, they do not count that as income for Healthy Indiana plans. That's just a little side note. And then your family and tax relationship. And what that means is they're going to ask you about your household. And when they ask you about your household, they want to know more specifically, is there a spouse? Because they would look at both of those incomes. And do you claim any dependents in your household, or are you claimed as a dependent? So if your household, you are single and you live with 2 other roommates, let's say, they're not going to look at your 2 roommates' income information. Does that make sense?
Hey, and we also have a question.
Oh, sure. And I'm going to have time for questions at the end too, but go ahead.
Perfect. Dawn asked, can you replace COBRA with Healthy Indiana plan?
Yeah, you can choose to do COBRA or not. And just for a quick definition of COBRA, so you know, we talked about employer-sponsored insurance. So those employers negotiate with health insurance companies to get your costs down. So when you lose your position, they have to offer you some sort of coverage for an extended period of time, your employer. So they will offer COBRA. Now, the bad thing about COBRA is those negotiated costs go away. So then you're responsible for the entire amount. So let's say you're paying $200 a month and the insurance company and your employers negotiated $400 in savings for your monthly premium. When you get COBRA, you're going to now be paying $600 a month. So that's why when people talk about how high and expensive COBRA is, that's how that works. Now, you don't have to take COBRA. So if you lose your position, absolutely, you could still qualify for Healthy Indiana plan. The other nice thing about Healthy Indiana plan is they look backwards at what you've done the last 30 days and not forward when we talk about marketplace to what you think you're going to make. So if I lost my job today and I'm done being paid, if I can provide a statement that verifies end of employment, I can apply today, and the eligibility decision guides that application for Healthy Indiana plan, which is FSSA or Family Social Services Administration. They will consider me at 0 income. So yes, absolutely. You can apply for HIP in lieu of COBRA.
Thank you.
Yep. All right, so let's kind of look at that chart. And again, you don't have to memorize this. And we're going to talk about where to turn for assistance when you apply. And these are the kind of things that we walk you through. This is my actual chart. I told you that I refer to charts. This one I keep up at my fingertips all the time because as soon as I guess the eligibility, I'm going to guess wrong. But here is an example of Healthy Indiana plan. This is the actual 2021 monthly eligibility guidelines. And you can see as your household increases in size, so does your income threshold. All right. And keep in mind, again, that's gross, both earned and unearned income. So if you would call me and you want help, first thing I would do is say, can you give me an idea of the last 30 days of your income? And you may have to refer to your paycheck stubs. If you get paid biweekly, I usually look at 3. If you get paid weekly, I look at 4. And we would add that and see if you fall within that category. Now, not everybody does. And it's 132% of the federal poverty level. I think traditional Medicaid is about I think it's 101%. So you're not getting a whole lot of jump. So some people just won't qualify for Healthy Indiana plan. And again, remember, these are adults, 19 to 64. So then what do you do? So in this situation, then we're going to look at our option in the marketplace. Now, marketplace has a lot of different names. You may hear it called Obamacare. You may hear it called ACA plans. The reason it's called Obamacare, remember the Affordable Care Act made all these changes to health insurance during Obama's administration. So that's why it's typically, sometimes called Obamacare. ACA, marketplace. Indiana's marketplace shopping tool is www.healthcare.gov or healthcare.gov. So you may hear them called healthcare.gov plans as well. So basically, the marketplace is this. It's a service that helps people shop. You're actually shopping for plans and enroll in health insurance. All those plans, we all know how to shop online, all those plans have been approved by the ACA, which means you can rest assured they're all QHPs. So we talked about QHPs. Every plan on the marketplace is a QHP plan. Marketplace is operated by the federal government. And again, in Indiana, those plans are available through healthcare.gov. If you don't have a computer or smartphone, don't worry, you can still apply over the phone or by mail. So it's not restricted to just doing it online. And then the nice thing about marketplace, you may qualify for cost saving subsidies based on your income and household size. So you get additional savings. Now, this was a big change to health insurance as well. The ACA said we want everybody to have an opportunity to purchase health insurance. So when I say you go on and you apply for a marketplace plan, you're not applying to find out if you qualify for that plan. You're applying to find out if you qualify for cost savings. And those cost savings are made available through a premium tax credit, where it's an actual dollar amount that reduces your monthly premium, or reductions in your copays, deductibles, and your out-of-pocket maximum amounts. And we could do a whole workshop on just the marketplace, so I don't want to get waylaid and kind of off track with that. But if you want more information, please let me know. So again, you're not applying for a marketplace plan, but you're applying to find out if you qualify for additional cost savings. These things you have to possess to even qualify. You must live in the United States. You must be a US citizen or a national or a lawful resident. I'm not going to sidetrack. So, or a lawful resident. And you cannot be incarcerated at the time that you do your application for cost saving eligibility. So normally, the only time, and this kind of mirrors what some of you may be used to with your employer health insurance, there's an open enrollment period. Normally that open enrollment period runs from November 1st to December 15th. So if you come in and see me on December 16th and you don't have a life qualifying event that allows you to have a special enrollment, unfortunately, I would have had to tell you, you have to wait till next year on November 1st before you can see if you're eligible for the tax credits and eligible to enroll into one of those plans. So it's really unfortunate. You had to wait all that time, and it's happened to me on December 16th, and it's heartbreaking. With the CARES Act, with the pandemic and legislation changes, a special enrollment was opened up, and that special enrollment, as of right now, is going to continue through August 15th. So if you are uninsured and you've seen the Healthy Indiana plan income requirements, and you know you're not going to qualify for that, and you're interested in seeing what's available on Marketplace, let me know by August 15th. I am hoping that it will be extended, but there's no guarantee. There's been no formal announcement. All right. So we've talked about adults 19 to 64, talked about employer insurance. We've talked about Healthy Indiana Plan as the expanded Medicaid plan. And they all have those income eligibilities. So what about your children? And again, remember that income guideline, because what I really want to focus in on is this, because I think this is kind of too well of a kept secret. A lot of adults assume that because they don't qualify for Healthy Indiana Plan, that their children are ineligible for any subsidized program as well. Through the Children's Health Insurance Program, which is a federal program that the state shares with the federal program, it's called CHIP, Children's Health Insurance Program. The income guidelines change quite a lot. And I'm going to show you those here in just a minute. So Hoosier HealthWise is Indiana's program or plan that covers children ages 0 until they turn 19. And remember, at 19, then they have to look at HIP. So let's kind of dive in here and look at this. And there's 2 packages in Hoosier HealthWise. There's package A and there's package C. Now, if you'll notice, we've kind of talked about federal poverty levels quite a lot. In package A, if a family's income is below 150%, and you don't have to worry about this, we have our charts of, or 150% or under of the FPL, they qualify for package A. Package A is a full service insurance plan, which means it covers all those 10 minimum essentials plus dental, vision. It's very good. It's no cost. There's no copays. There's no premiums. It's also, you're locked in for a 12-month eligibility period. And you do have the freedom of choosing your provider. So you don't have to stay in a particular network. Now, package C, let's say you go over 150% and you're at 151 to 250% of the federal poverty level. Your children can qualify for package C, which is also a full service plan, but you do have some low cost sharing involved. So you may pay a copay, you may have to pay $3 to $4 at the pharmacy, but you can also choose your provider in that. For families with more than 1 child, I know they do a reduction for that second child. So like 1 child may be $53 a month. If you have 2, then they go down to $33 for each child. And then they cap those off too. So let's look at the income guidelines at the 250%, and you'll see what I mean by such a much more generous. This is the actual 2021 eligibility. So a household of 4 to receive that package C for your children, they can make $5,631 a month. So, I mean, you're looking at over $63,000 a year. So that's very generous. And that's why I say this is a too well of a kept secret. So maybe your company offers insurance and to join your family plan, it's raising your rates way up. Reach out to us, see if your children qualify for CHIP. It's gonna knock that down for them, you and your spouse, or just you. Stay in the individual plan through your employer. You put your kids on CHIP and it frees up your budget. Does that make sense? And you can have employer-sponsored insurance as that parent and still opt to put your child in the Children's Health Insurance Program. There's no conflict there. All right, so where do you turn for help? So I kind of gave you a really quick overview of those 3 programs, just to give you some options, because these are probably the most common options. I either get an employer, I don't qualify for that. Can I get HIP through the state? You don't qualify for that. Can I get marketplace? Let's see. Can my children get insurance? for a lesser rate. So where do you turn for help? So I mentioned I'm a navigator. A lot of people never heard of an insurance navigator, or you may wonder what the difference is between a health insurance agent and a health insurance broker. I'm going to kind of quickly go through that. So Indiana navigators are licensed through the Department of Insurance, and there are certain things they can do and there's certain things they can't do. They can help you complete your application, follow through with your application status, make sure you get enrolled, speak on your behalf during the application and enrollment process, remind you of certain dates that are coming up. And probably the best part, any mail you get, I get a copy of as well as your authorized rep with your permission and your consent. So I just tell people it's like I'm your insurance wingman. That's the easiest way to remember. So what's the difference between an agent and a broker and a navigator? I'm not going to read this. This is a very busy slide, but you'll see that they're very similar. They are also trained insurance professionals through the Department of Insurance, held the licensing and continuing ed standards. But the biggest difference is they get paid a commission to either work for or represent certain insurance companies, whereas a navigator, I am obligated to provide you with unbiased assistance. I hear your options and I lay them all out. So that's the biggest difference. And our services are, best part, free. Yes, we are free. We are funded or paid for through grants like the one I told you about in the beginning. Not everybody can be a navigator. You have to be connected to an application organization. I'm going to tell you how to find navigators here in just a minute. Again, it's unbiased. We're not agents or brokers. We just help consumers understand their coverage options. We do receive that training. We have to go through background checks, take tests, all that good stuff. We don't recommend plans. I wouldn't say, hey, jump into Anthem. That's better. I have no reason to. I don't get anything in return. And then we help consumers apply for or enroll in Medicaid, CHIP, which I talked about, and those marketplace plans. So where do you find a navigator? These are application organizations. We partner with these organizations. My team, if you remember, is only made up of 3.5. So obviously 3.5 people can't take care of the entire state, which we do serve. So this is an example of agencies that have navigators covering kids and family, us connecting kids to coverage. HRSA is the Health Resources and Services Administration. They have FQHCs. What an FQHC is a federally qualified health center. I'll name off a couple, Jane Pauley, Shalom, HealthNet. Those are all examples of FQHCs. They are required to have navigator services at those locations. And then ClaimAid, they're oftentimes in hospitals. They are paid navigators by the hospital. So if you go into the emergency room and you're uninsured, you may end up speaking with somebody from ClaimAid. All right, blank slide again. We're going to do that. We're going to wrap it up and do that word association. So now I'm going to say Anne, who works for IRHA on the Connecting Kids to Coverage program. And I hope, oh, my picture's supposed to be in there, it's gone. Instead of thinking of Flo, Flo's thinking about me. So I want you to think of my face in that bubble. And then if you liked what you heard today, go ahead and like us on Twitter, like us on Facebook. You can find us on the web. One quick neat thing, I included that QR code. We're all familiar with those now from going to restaurants. If you scan that QR code, it's going to pop up a scheduler. That's the best way to get a hold of me. It takes 20 seconds. You put in your information. You let me know the best time to call you. I call you within 2 business days. So that QR scan is really, really handy. And questions? And I'm going to stop sharing my screen because I miss at least your names. Hold on just a minute. Stop share and start video. And there I am. Okay. And I can see the chat now, Tiffany. I couldn't see the chat before.
You're all right. I know it's a
I'm
lot
just
going on.
let you read them.
Okay, yeah, you didn't miss anything. I asked the one question that we had from Dawn, and then Dawn was just saying that she had to go for another Zoom meeting. She said, thanks so much. She'll look forward to the recording.
Oh, I love you, Seth. Flo, I love her. Me too. I do too. I love Flo. And I get teased a lot for being like Flo, which I don't know if that's good or bad, but I don't love insurance. But my husband says you don't have to ask every waitress if they're insured. All right. I don't know how I am on my time. I don't, oh, just at an hour. Okay. It was long. You guys were great.
Yes. Does anybody have any questions for Ann or anything they want to ask?
And I will let you know too, real quick, I mentioned I'll be sharing my slides back with Tiffany. We do a lot of FAQ booklets. I'm gonna here soon, hopefully turn this type presentation into an FAQ. So you'll have kind of these hot topics at your fingertips.
Cool.